Good evening. Most of the doctors in the state of Maharashtra may be aware that there is a bill which is in the public domain. And what is the bill? The bill is a bill to provide for registration, regulation, and inspection of clinical establishments in the state of Maharashtra, to prescribe minimum standards of facilities and services which may be provided by such establishments and for matters connected therewith or incidental thereto. महाराष्ट्र में जो बिल आया है, इस बिल से एलोपैथी ऑल ब्रांचेस, होम्योपैथी, आयुर्वेदा, यूनानी एंड डेंटिस्ट्री जो महाराष्ट्र में रजिस्टर्ड है, दे आर मोर देन 5 lakhs इन नंबर्स, क्लिनिकल एस्टेब्लिशमेंट्स एंड डॉक्टर्स प्रैक्टिसिंग इन द स्टेट ऑफ महाराष्ट्र. इनको इस बिल से डायरेक्ट और महाराष्ट्र के तमाम पेशेंट्स को, लोगों को, जनता को सीधा असर होने वाला है. तो पहला हमें जानना चाहिए कि ये बिल आया क्यों और इसके एम्स और ऑब्जेक्टिव्स क्या है. तो इस बिल को महाराष्ट्र के हेल्थ मिनिस्टर, इन्होंने असेंबली में टेबल किया, फिर वो 21 मेंबर्स की सेलेक्ट कमेटी बनाई, और अभी जो रिसेंट नोटिफिकेशन आई, उस नोटिफिकेशन से ऑल स्टेक होल्डर्स दे मस्ट सजेस्ट suggestions or amendments to many of the clauses which are incorporated in this bill. So let's understand what does the state government wants to do. The state government wants to create an act once this bill gets accepted, which is likely to happen in the winter session of the assembly. If it gets accepted, how it's going to affect all of us. So, but what is the idea behind bringing this bill? The idea behind bringing this bill is that they want to codify all the clinical establishments, right from robotic surgery hospitals where robotic surgeries are carried out, and doctors who are sitting in a small by-lanes practicing his pathy, either allopathy, Unani, homeopathy, dentistry, or Ayurveda. So this bill encompasses every clinical establishments in private domain, not in government domain. These are the highlights. What I am trying to tell you, they are the highlights of this bill. Now through this bill, they want to create a council which would be called as Maharashtra State Council for Clinical Establishment. Under that, they will have Clinical Establishment Registering Authority. That registering authority will register and first give provisional registration. Of course, you have to pay a fees for that. After 6 months, permanent registration. There are many clauses in that. And also they have provision for non-transferable and cancellation of registration. You have to mandatorily display rates and charges for the services provided by the clinical establishments at a prominent place in its premises. It is to be in 3 languages: Marathi, Hindi and English. And also to provide for charter of patients' rights. It also encompasses to provide for inspection of clinical establishments and to provide for offences and contravention of provisions of the Act in which your clinical establishment's status can get cancelled. I want each one of you to please read this Act. In our opinion, Healing Hands Unity Panel's opinion, this is likely to create over bureaucratized system. It will bring back license Raj, permit Raj, Inspector Raj, and Renewal Raj. I am specifying renewal because you know those doctors who go for the renewal, especially of nursing homes owners or sonologists, in spite of having everything as prescribed, you do have to palm the grease the palm, whatever it is. So doctors, please read, find out what is good for the medical profession, what is good for the clinical establishments. सभी डॉक्टर को आयुर्वेदिक, होम्योपैथिक, यूनानी, डेंटल, एलोपैथी सभी को मेरी गुजारिश है जिनका नंबर इस स्टेट में 5 लाख से ज़्यादा है कि आप कृपया इस एक्ट को पढ़िए और आपका ओपिनियन 20 अगस्त लास्ट डेट है, उसके पहला गवर्नमेंट को या उस बॉडी को कम्युनिकेट करिए। धन्यवाद। मैं डॉक्टर तुषार जगताप, कन्वेनर हीलिंग हैंड्स यूनिटी पैनल। थैंक यू।